I'm a physician from Bristol in England, and I've specialised in pain management for many years, and my particular interest within that subject is nerve pain, of which probably the most common form is post-herpetic neuralgia, which is a condition following herpes zoster. And that inevitably has taken me into the realm of how to treat it and how to prevent it. Well, treatment is not highly successful for a number of reasons, so prevention is very attractive. The only certain way, or not quite certain, but good way of protecting against developing herpes zoster, and of course if you don't get herpes zoster you can't get its complications, particularly post-herpetic neuralgia, is by vaccination. We now have 2 vaccines, one available and has been available for a few years, and one which is almost certainly about to be licensed for use in Europe. Both are efficacious, and certainly the first one has been in use long enough to have been shown to be effective in the real life situation as well. Both have some advantages and disadvantages. The vaccine called Zostavax, which is a live attenuated virus vaccine, is very safe. It's a single dose. It doesn't cause much problem with soreness of the arm or with malaise following injection. But it is more effective in younger people, people of sort of 50 to 65 or so, than it is in those over the age of 70. And the duration of protection that it offers is probably going to turn out to be 6, 7, 8 years, but possibly not very much longer than that. The vaccine, which is probably about to be introduced in addition, is effective in pretty well all age groups, including very elderly patients, and its duration of effect appears to be greater. But it requires 2 injections, and there is relatively more what we call reactogenic effect. In other words, soreness of the arm and a bit of malaise with headache for a few days after injection. Zoster occurs most commonly in people over the age of 50, and indeed the severity of its complications is greater in that age group as well. So it's older patients who are at greatest risk of both developing zoster and the complications. So vaccination is highly desirable and should be encouraged. Programs that have been in operation, one in England certainly for more than 3 years, have shown that indeed such programs are effective in reducing the incidence of herpes zoster and its complications, and there have been no particular safety studies, and no particular safety issues at all with its use. But public awareness of shingles, herpes zoster, is not very great. There have been a number of studies in various parts of the world which have shown this, and to get people to want to be vaccinated is an essential part of any vaccination program. And that requires understanding of the disease and the fact that the complications can both be very unpleasant and very long-lasting.